My grandma said when I was a kid, an ounce of prevention is worth a pound of cure. And I'm very interested in how we can get people into this health journey where you nip it in the bud before it gets too bad down the line. And the anecdote was that she had an employee of hers who had a toothache. She was complaining about the toothache for weeks and weeks and weeks and weeks. They didn't have their own provider. By the time they got too bad, they couldn't come into work. And in order to go back to work, they had to get signed off, meaning they had to go see somebody. Well, it was 11 months. They couldn't get an appointment anywhere, so they're stuck in this limbo.
We're here with Rich Trapp, Director of Corporate Accounts for
Access
Care.
Yes.
Tell us a little about yourself.
Well, I was born on a strawberry farm, almost literally.
Strawberry farm. Okay.
Cincinnati, Ohio. Went to school at Ohio University.
Go Bobcats.
Athens.
Yes.
And a long and storied road to get all the way here to Bloomfield, Connecticut.
Yeah. You're an LA guy.
Yeah, for a long time.
Yeah. Shortly, because you're soon coming back to your roots, right?
Coming back to Cincinnati,
When's that?
Fall 2026, possibly.
26?
Yeah.
Okay.
We got some things to do.
Another year in
we got
lovely SoCal.
There's some other things to sort out, some family things.
Okay.
Crossing fingers. Yeah.
Good. Okay. So you've been with Access for how long?
It's 2 years.
2 years.
To June, right? June, July, August. Yeah, 2 years.
Yeah. Almost exactly, I think.
Yeah. A lot packed into 2 years.
What was our first? That was the retail benefits conference, right? In Chicago?
No, I did.
Was Bath and Beyond? No, that was after.
Bath
and Body Works at the retail, so it had to be the first one.
Yeah, I did Bath and Body Works was the first one because I came out to Marietta for a week and then we hit the road.
Okay.
Yeah.
You didn't go out to.
No.
Your presence was there.
Yeah, I was there. Yeah.
Okay.
Ghost in the machine.
Yeah, and I should have said, well, what's your background before that?
So, for years I did a couple of different things professionally. One, entertainment, so music and on-camera stuff and voiceovers. But professionally, for years I did a lot of promotions and marketing. So experiential was my main focus. So I went from doing activations, we call them, what we call events, and doing tours with Beyonce and the X Factor. Pepsi was a big client of ours. So I would, manage those tours, but I would also oversee build outs of the vehicles. And so coming over here now into this side, I went from
just throwing a little bit of
vehicles,
dust in there,
went from vehicles to vehicle, to tours to tours. Yeah, full circle.
Very good. Okay.
And now preventive care, which is, because I have my own kind of health journey, is right up my alley. Yeah.
Okay. So, I don't know. Give us your thoughts. What's good about Access Care? What do you love? What do you hate? Where's stuff in between?
I start some calls with clients by saying, my grandma said when I was a kid, an ounce of prevention is worth a pound of cure. So what I'm starting to see is that we are able to do some good out there, which is mind-blowing. Amidst all the details and the granular day-to-day stuff that we have to do, I'm in the middle of Outlive by Dr. Peter Attia that you cite quite often. And I'm very interested in how we can slowly, one by one, get people into this health journey where you nip it in the bud before it gets too bad down the line. And I'm starting to see it not only anecdotally from people I speak to out in the field, but from OC health nurses, for example. We have a great people that we work with all the time, but one in particular told me a story about. The anecdote was that she had an employee of hers who had a toothache. She was complaining about the toothache for weeks and weeks and weeks and weeks. They didn't have their own provider. By the time they got too bad, they couldn't come into work. And in order to go back to work, they had to get signed off, meaning they had to go see somebody. Well, it was 11 months to see somebody. They couldn't get an appointment anywhere, so they're stuck in this limbo. So when I said,
I know where that location is.
I think you do as well. So when I said, is this working? She said, that's the example. Now, when I identify that, I know you guys we come back there quarterly. So she says, well, at least we know you can get in and book it now before you forget. And she's the one that grabs people by the ears and brings them down to their appointment, and they love it.
And as you're talking about the book and everything, it really is, if you can get, the whole theme of that book is if you can get people started practicing in good preventive behaviors that they're accountable for themselves, that's going to bleed into more healthcare preventive services that they're going to be looking for. They're not going to stop with one thing. They're going to keep on going. So, as you said, I think Access Care is really trying to just do a little bit of good, here and help people get more knowledge about their own health. How is it, you got, obviously we're here, as you said, Bloomfield, Connecticut.
Cigna Group headquarters, right out the window right here.
You work with a lot of their teammates there.
Yeah, great folks.
Yeah. What have you learned from them?
That's
takeaways are?
the great question, and what's really cool is that I got to see their health clinic. I did a little tour there.
I don't know if it was little.
No, it was a big tour. I told them, I said, this is bigger than any doctor's office I've ever been in. I mean, it's huge.
Yeah.
And what's really cool is that they care about their people, which is great. And, you know, a lot of the benefits, it's all in the background, you know. You don't really see all of the work and all of the blood, sweat, and tears. And in order to make a shift in people's attitudes and in their approach to health and the paradigm shift in their kind of health stream, to have a pod or something like this that shows up and is visible and you can kind of attach some of these health initiatives to, they love it. I mean, it just is this big billboard for, let's use this for everything. So that's what I'm excited about, is not only to do these one-off events, but if it becomes sticky and people start to associate us with this preventive care, let's do all of it, you know? Let's be your go-to for nutrition. If you have trouble sleeping, we can address that. It's not just, we can do one little thing at a time, but it's the whole being, the whole patient. And that's what I've learned from them, is that they're excited about that. Not just get in and get out and see you later, but what happens next? How can we get that last, you know, that last inch over the line?
And the clients, I mean, they're coming to Cigna for these solutions, these innovative solutions. I mean, they're really listened to by them, right? Yeah,
that's the conduit, and that's what Cigna's been so great as a partner, is that they truly not only understand the needs of their clients, but they are innovators as well. I hear that constantly, in that they want new solutions and new ways to get this stuff delivered, and that's where we come in. So it's been great intersection.
Earlier I was talking to another individual from Cigna Group about this, and the whole environment and the kind of, I don't know if you want to say, like the HR realm, you know, it's not necessarily the most, generally speaking, the most risk-taking, innovative environment, because they are, I mean, at least from my experience, and I mean, this is maybe a little bit sad but true, but the benefits in HR teams are usually not like just stocked with the number of people that might be in operations or in finance or other departments. They're usually pretty thin on the teammates. So they have to look to outsiders for innovative solutions. And they've usually got HR consultants and brokers, other stakeholders outside of the organization that they could leverage. But I mean, it's really that relationship with their medical and dental insurance carrier that is bringing this to it. So, I mean, if Access Care can be of help, or that's great. But you know, at the end of the day, it seems to me that a lot of these clients are coming to Cigna looking for holistic solutions, looking for innovation, because they might not have the internal resources to get out there and do it. Do all the not just finding it, but the implementation and the execution and the analysis afterwards. So at least that's what I see.
No, I've seen that too. And actually meeting with some folks out here face to face has been great. I think we should do that more consistently and on a broader scale to let them know what we can do. For example, I'm a big audio guy. I'm a musician. I'm very heavily invested in the hearing piece. Thank you. And when I first started it was actually at Bath & Body Works, and we were giving some folks some hearing assessments. I just wanted to know a little more. And I found a white paper from Australia. It was a research paper about the effects of hearing loss on cognitive decline. And what they showed was a 1-to-1 ratio. Every single person with cognitive decline had some form of hearing loss. And when I was discussing this with people and talking to them about their hearing, 90-some% hadn't had a hearing test since they were in second grade. And it's the number one, the posterized kind of thing, and the takeaway from the white paper was it's the number one determinant for cognitive decline later in life. And no one's touching it.
Because they're just not, when you can't hear, you're not paying attention to it, and so
you lose the connection.
You lose the connection, so you just become disinterested, or people think you're just disinterested.
Correct.
Tell us a little bit about a new partner that Access Care has in regards to that.
And that's what I was leading up to, because I've got occasional, what I used to call tinnitus, but a friend of mine who has it calls it tinnitus. I guess that's the way that you pronounce it. I don't know. He has it, so I trust him.
Sure.
I played music for a long time with a big horn section right behind me. So in the middle of the night, I occasionally have I get the sound. So it's coming.
It's like a reverberation from
hearing that. Yes, it is. But it's also a high pitched kind of whistle that if anyone has ever had tinnitus, that there's forms of it, but it's a tone. So I know something's coming down the line. So our partner EarGym, I've been on their app now for a couple of months, doing these little games where they've told me, and I've seen some evidence that they can improve our hearing by 25%, meaning I'm not only improving whatever the inner workings are, but the connection, so the brain hearing connection is getting activated, just like you do crossword puzzles and you get your cognitive going. It's an app where, and it's gamified too. It's fun. You play these little games. I'm in a coffee shop and I'm listening to.
So what do they do? They come into Access Care. They do a health or hearing assessment.
Right. So
and then the app is on their phone.
Right. So you go, hey, listen, we're gonna test you a couple of different ways, but what we're gonna do is give you the opportunity as part of this assessment to get EarGym on your phone. Let's say for a year. Try it out. See what you think.
Yeah.
And most people, I think you're the one that told me 25% of people over the age of 25 have some form of hearing loss, which is crazy.
It's crazy, but it actually makes sense when you think about whether it be loud concerts or wearing headphones all the time.
Everybody's got the in-ear things, and
no one recognizes when you don't. If you're not seeing well, that's one thing. You're like, okay, I really can't see that straight.
That's right.
Probably people are not. They don't even know that they've got some level of hearing loss.
That's right.
Until they're probably checking it again from second grade all the way till when they're 60.
Yeah. Or their spouse or their son or daughter knows for sure that they have some form of hearing loss.
Okay.
But if we can get it, if you can get it while you're still a little bit elastic, it's like when people get into their 80s and have to have hearing aids, it's a lot of that. It's too late, even though you can help supplement it with that.
Yeah.
And even that's kind of stigmatized. They've got these in-ear ones now that are really. Anyway, I was really excited to find out about that technology, and it's something that's fun and engaging, and it works, because a lot of these things, you can roll out these health initiatives and it's big and shiny and great, but like who uses it, And it's one of these things where we can have this
tracking it afterwards. You can see how many people go in and say, okay, like these people had, when they started, they had, I don't know, I'm just making this up, 20% hearing loss, and if they do this app and they use it, then in a year's time, you can see that
you literally see it being improved.
Right.
And what I really love about this model, about Access Care's model, is that it's this engagement session. Yeah. So anytime that I've observed or sat down with an employee or a patient and talked about it, it's opening up a conversation that just wouldn't happen without these sort of engagements. Yeah. And then they can advocate for themselves, They might get a hearing test that says there's a little bit of loss. Next time they go to their doctor, they can go, hey, I'm going to talk about this.
Yeah. And that's, honestly, just talking about it, just getting it out there.
That's right.
There's so many people who, you just get busy in your life. You got a million things going on. I'll take care of it later. And next thing you know, it's 5 years gone.
Yeah.
What could you have done in that 5 years? Again, it comes back to that book. It's like, if you can start on this stuff early, and this, what is now in the book referred to as either medicine 3.0
right.
or proactive health,
right.
where it's not preventive. It's forget the preventive side. It's proactive. What are you doing today so you can live the rest of your life at the fullest, not at some degraded health status when you should be, smelling the roses, relaxing a little bit,
And you come on the pod and you get your dental exam, but at the same time there's a bio and labs that you want to take care of, and you sit down and you get your numbers and you look at it and you go, okay, actually I've been thinking about moving a little bit more, or I've been thinking about throwing a little more greens into the mix, and that starts the conversation because the numbers are there and you're not kicking that can down the road anymore.
Yeah, and then you gotta have the recurrence. You gotta have this continuity of care where you're going to see them again. That's why clearly I get 2 dental examinations and cleanings a year.
Yep.
Nothing wrong with that. That's got to be a positive at some level. But I think it's as much of a positive as to get your teeth cleaned. It's just having that interaction.
It is.
With the dentist. How you doing? How things going? How's your life? And you get this reward. Then you set that expectation every 6 months you're going to do it.
Yep.
And so it's the same thing. Whether it be the hearing, whether it be musculoskeletal, whether it be vision, you just got to get into that routine, that habit, and do it. Yeah,
we were up at Tailored Brands in Dublin, and I was talking to our dentist for the day, the doctor, and I was asking just about oral hygiene, because I just was interested in what her take on that was. And she said one thing, and that was that the reason that we floss every day, or should, is that plaque regenerates every 24 hours. I'd never heard that in my life, and I have flossed more in the last year than I have literally in my entire life, just because every day I go, oh, it's another 24 hours. You can't wait. Yeah.
Okay. Well, this is good. Okay,
yeah.
So let me just ask, this is a learning process for Access Care, and you're in front of these great Cigna and other insurance carriers, talking to them. You're talking to these clients all the time. What can Access Care do you think, to improve? Is there something we can do that we haven't touched yet, or that it's like, hey, this is, we're getting by with this, but we can do something better?
You know, I heard a story about a guy who runs, it's the best restaurant in New York. It's someplace, some Washington place or whatever in New York City. And the head chef, the guy who's the owner and the founder, said he took his team before they built it out to all the top 10 restaurants in the world or in the United States. And every single meal that they went to, he'd say, tell me what you thought. And they'd go, I loved the foie gras, I loved this, I loved that. And he would say, now tell me the 2 things that they didn't get right. We're going to do that. We're going to take those 2 things, and that's what we're going to focus on. And the one thing that I do know that we're really, really good at is proactive communication. And that's the one thing that I hear from clients and from people on the ground is other experiences have not been so proactive. I think we do that really well. The other thing that I hear about is, in the meantime, what else can we add to the mix? And that's where we're rolling out some telehealth solutions. And I think that the stickiness of the events on the ground mixed with in between, how can we supplement that and be kind of that presence all the time? Those 2 things I think are really, really key.
And I think what I heard you say of the things that what we could do to improve is we should also get out there and start talking to our teammates and finding out from them what are we not doing right, or talk to other strategic players, just like the restaurant owner did, taking them to talk to other people in the marketplace, figure out what they liked about what they're doing or not, and then feed that back in to our own organization as well as possibly to our partners like Signet.
Absolutely, And I just
like how you moved it to the good things we were doing, but I just wanted to
but that is my point. You know, I just met with a client last week. We had coffee, and she specifically asked me, how are we taking the learnings that we have at each event and incorporating them into the next one? And I've got a hit list of those things that now becomes the SOP. And what I said to her in our plan is that she's got her own list. I'm going to merge ours together and then present it, because it's great to do it on our side and improve, but then we hold it up, you know, be very, very clear and go, is this what you're thinking? Because this is what we're thinking, and now we can get better together.
And definitely having that communication.
Totally.
Rather than just relying on an email and sending over, here are these stats that we had, here's these surveys. It's like, if you don't take that time to have that communication, you may think that the partner or the client is understanding what you're saying, and they don't. I mean, it's like written communication. I think it's so difficult. It's so difficult. You cannot ensure that somebody understands what you're trying to say, or even as you're thinking it through, you've put the statistics together, and as you're talking it through, you're probably going to find things in what you're saying. It's like, oh wait a minute, I did miss that. So I mean, I think it would be good to do that, is to get to a lot of our partners. And see what they're doing, see the things they could improve upon, and then focus on that to become. Will always be an improvement process, but well, Rich Trapp, thank you so much, sir.
Thank you, brother. This has been great on the podcast of Access Care, episode 2, maybe.
Is it episode 2
or 1.2?
Yeah, it's 1.2. I don't
1.5.
think we're 2 yet. Yeah, do a couple more, then we'll make it official. All right,
good to be here. Thanks for having me.